Welcome to another video of Health Facts with Dr. Danesh. As the risk of blood clotting and stroke rising among the patients with COVID-19, I decided to share my thoughts with you to see the results of a hospitalized patient with vascular issues from COVID-19 and what they suggested other than staying active and breathing exercises, which was described in my past videos about vascular issues in COVID-19. In my video about vascular disease in COVID-19 infection, we saw how SARS-CoV-2 could decrease the number of ACE2 receptors, and that could increase the superoxide species, which could cause the endothelial damage through the oxidative stress, and that could increase the D-dimer and 1 Willebrand factor, which could increase the number of platelets in our circulation and eventually increase the blood clotting and coagulation. And that's why we see many blood clotting in patients with COVID-19, specifically in patients with underlying disease such as diabetes, cardiovascular disease, and some other chronic diseases. For better understanding and to give you an example of what we just mentioned, I'm going to introduce this patient and this article that is recently published in Thrombosis Research under the title of Severe COVID-19 Infection Associated with Endothelial Activation. So this is a case report of a 72-year-old previously healthy male patient admitted to the hospital 6 days after the onset of respiratory symptoms and fever. 6 days after admission, following a rapid deterioration of his clinical condition with development of acute respiratory distress syndrome, acute renal insufficiency, and altered mental status, he was transferred to the intensive care unit. Supportive care with intubation, positive pressure ventilation, and renal replacement therapy led to a stabilization of his condition. During the ICU stay, a continual increase of D-dimers was observed, from initially 0.69 milligram per liter to 2.55 milligram per liter. On day 4, 2.81 milligram per liter on day 11 to 20.63 milligram per liter on day 21. So it's a big jump from 11 to 21, from 2.81 to 20.63, which is a very odd rate. Furthermore, on day 21, they observed a concurrent massive elevation of 1 Willebrand factor with 1 Willebrand antigen 555% more than normal. So the normal range is 42 to 136%, and 1 Willebrand activity of 520%, and the normal being 42 to 68%. Accompanied by an increase of factor 8, which is one of the coagulation factors, of 369%, which normally is between 55 to 164%. So for this patient, they increased the prophylactic anticoagulation with dalteparin from 5,000 USC to the therapeutic anticoagulation with unfractionated heparin on day 21 without hemorrhagic complications. Since then, the patient is steady, improving ventilation, and hemodialysis could be successfully withdrawn. D-dimer decreased to 6.26 milligram per liter on day 24 and to 1.94 milligram per liter on day 29, as you can see. So they concluded that considering the high levels of 1 Willebrand factor and factor 8, they strongly suggest administering higher, possibly therapeutic doses of anticoagulation to these patients, which means COVID-19 patients. So after noticing all these patients with blood clotting issues, patients with COVID-19 in any ages, I decided actually to share my thoughts with you in patients who are not hospitalized and tested positive. And so I believe we should check 1 millibrand factor, D-dimer, and factor 8, which is one of the blood clotting factor or coagulation factor, every 10 days if there is no underlying factor. But in patients who are hospitalized, we should check the 1 millibrand factor and the dimer and factor 8 every 2 to 3 days, or maximum every 3 to 4 days. And if there is a slightly higher level, we should definitely start the therapeutic anticoagulation for these kind of patients. However, if there is an underlying disease, we should definitely start the prophylactic anticoagulation therapy. Thanks for watching. I hope you enjoyed this video. If you like this video, please like, share, and subscribe. Hope to see you in my next videos.